I'll be teaching appendicular skeleton on this video. I had earlier looked at easier skeleton, so if you need to go back to that video, that would be great. Um, so appendicular skeletons are the skeleton that makes up the appendages, the attachment of the body. And so those are not part of the axial skeleton, they are appendicular attachment skeletons. All right, so here are the attachments to our body now: the pectoral girdle, the upper limb, the pectoral girdle, the upper limb, the pelvic girdle, the lower limb. Those are the bones that makes up the appendicular skeleton. Right? Now, the first thing we will look at there is the pectoral girdle. So the first thing we're going to study this on this is going to be the pectoral girdle. When you look at the pectoral girdle, it is made up of the scapula and the clavicle. So you see the clavicle articulates with the sternum at the sternal end or the medial end of the sternum of the clavicle, and also the lateral end articulate with the acromion of the scapula. I'm going to look at each of them and then we discuss each of them as we go. So the clavicle is the first bone we are going to be looking at. And like I told you, the clavicle has like an S-shaped appearance. And on the medial end of the clavicle, it's articulate with the sternum, so we call it sternal end. And it makes a joint there. The name of the joint is called sternal clavicular joint. So sternoclavicular joint. And then at the lateral end, it articulates with the acromion of the clavicle, of the scapula. So it forms acromioclavicular joint right there. All right. So that is the clavicle. I'll go ahead and look at the sternum, the scapula. All right. So when you look at the scapula, here are the images of the scapula. Now, on the scapula, if you're looking at it on the inferior angle, as though you are looking at me, anteriorly, as though you are looking at me like this, this is the way you will see my scapula appear. Now, the scapula have two angles. It has a superior angle right here and the inferior angle. And you can see it right there. This is the superior angle here, and this is the inferior angle here. All right. Now, the scapula have three borders. It has the medial border. It has the medial border, means that's the border at the middle, and it has the lateral border is on the lateral side, and we have the superior border right there. Now, when you look at the anterior portion of the scapula, you are going to see what we call subscapular fossa. When you look at the scapula, you're going to see the subscapular fossa, and the subscapular fossa is right here. Here's the subscapular fossa there. Now, that is the anterior view. Now, posterior view, when you see posteriorly, you're going to see the major thing you see on the posterior view is first the spine. And the spine, most of us can touch our spine right here. You can touch your spine. Now, the spine is what you touch mostly here. Now, the spine continues to form what we call the acromion. So it's a continuation of the spine that is called acromion. And there is a point that we call the glenoid cavity, which is actually the point that connects with humerus that makes the shoulder joint, which is actually called glenohumeral joint. I'll talk about that. Now, on top of the glenoid cavity is what we call the coracoid process. You see that? That's the coracoid process. So the acromion continues to form, the spine continues to form the acromion, then coracoid process is around glenoid cavity. Now, when you look at the spine below the spine, there's a depression because spine is a projection, right? So there's a depression. That depression is called inferior spine depression. So it's called infraspinous fossa. Fossa means depression. And right here, also above the spine, there is superior spine fossa, meaning that the fossa, the depression, is above the spine. So supraspinous fossa. All right. Now that's the neck of the spine right there. And that's the body. All right. The other side, on the anterior side, is what we call the suprascapular fossa. Now, when you want to know if the scapula is the right side or left side, all you need to do is looking at this now, looking at this and picture it as though you are looking at me from behind. You see myself here, you see my spine here, and this is the glenoid cavity where the humerus is going to connect to. So that means this bone right here is a right scapula. Anywhere when you position it like this, having it posteriorly, where the glenoid cavity is facing is a side of the scapula. So that tells that this is the right scapula. Now, here we want to look at the upper limb into details. Now, when the upper limb, the first bone in the upper limb or the upper extremity is the humerus. And you have two of them, one on each side. Then you have the radius, then you have the ulna. I call it radiolateral to tell that radius is on the lateral side and ulna is on the medial side. The same thing here, you have the ulna, then you have the radius. Now, you have 8 carpal bones here. The bones here that form your wrist bone, we call it carpal bones, all right? We call it carpal bones. And the thing about it, don't forget, you drive your car with your carpal bones, all right? Then right ahead of it here, you have the metacarpal bones. These bones does not have name, but these bones, they have different names. But this one, we just call it metacarpal 1, metacarpal 2, metacarpal 3, metacarpal 4, metacarpal 5. Then right after, you have the phalanges, all right? You have the phalanges the same way on the other side. So let's go. So you have the humerus, the radius, the ulna, the carpal bones, metacarpal, and phalanges. So humerus, radius, ulna, carpal bone, metacarpal, phalanges. Now, on the humerus, looking at the humerus, what do you see? On the humerus, the first thing I want you to take note of is how does the humerus articulate with the clavicle. The head of the humerus is right here. And it is this that fits into the glenoid cavity as ball and socket joints. So this ball fits into the socket on the glenoid cavity, all right, on the clavicle. And it forms the joint that we call glenohumeral joints. Glenohumeral joint. Sorry, I'm writing with my mouse. So that's glenohumeral joints. We have the greater tubercle, which is a projection right here. Then we have the lesser tubercle, which is the projection right there. And majorly, that's what helps to give the position of the anatomical neck of the humerus. Now, this will be the shaft or the diaphysis. I talked about that in the previous chapter. And right here, we have the medial epicondyle and then the lateral epicondyle. Then we have the capitulum here. We have the trochlea here. All right, so here is the trochlea, and both of them makes a condyle, which is why this is epicondyle. Epicondyle means, epi means outward or upper. So you usually see epi when it's something outward layer. So when this area makes the condyle, then this will be the epicondyle. So the epicondyle that is closer to the middle, medial epicondyle, the lateral condyle will be the one closer to me. So now looking at this bone alone now, you can mostly tell that this will be on this side of the body. So looking at this, you can tell that this is actually here. So that means this is the left humerus. All right, you see the head is going to fit to the glenoid cavity. This is the medial, so medial epicondyle is going to be here. Medial epicondyle is here, lateral epicondyle is here, and that is the left humerus. All right, let's go. So looking at, we've talked about the shaft, the body or the shaft, anatomical neck. The idea of anatomical neck is that is the, idea of anatomical neck is that is the actual neck. And then we have the surgical neck, which is the area that is distal to the tubercles. And the idea of surgical is that it's the point that will be cut from when there needs to be surgical procedure. Now, the humerus, the distal end of the humerus, which is right here. So on the distal end of the humerus, which is what I talked about earlier, you have the epicondyles, the condyles, which is lateral and medial epicondyles. Then you have the condyles right there. Now, the epicondyles, majorly its projections on the distal humerus, and those are point of attachment for muscles of the forearm. Then you have the capitulum right here, like I pointed earlier. The major thing is that the capitulum is what articulates with the radius. And then you have the trochlea, which is the part that articulates with the ulna. And you're going to see trochlear notch on the ulna when we look at the ulna. Then on this side, which is posterior view, you're going to see the olecranum fossa. Now, this is olecranum fossa. The olecranum is on the, now, when you see notch or fossa, it's a depression. So olecranum fossa of the ulna, olecranum fossa on the humerus exists because there is an olecranon on the ulna that will fit into the olecranon fossa. So think about it. Olecranon on the ulna fits into a depression on humerus, and that is why we call the depression olecranon fossa. All right. Now, so here is what we have. The forearm is composed of the ulna and the radius, and it articulates with the humerus to form the elbow joint. And here is what I was showing you just on the previous slide, that if you look at this now posteriorly, this is the olecranon on the ulna, and it fits into the olecranon fossa of the humerus. All right. So the depression where the olecranon of the ulna fits into is what we call olecranon fossa on the humerus. And here is a capitulum on the humerus where the radius fit into. You see that? So this is the radius, head of the radius articulates with the capitulum right there. And this is the ulna articulating with the trochlea, and also posteriorly it articulates the olecranon of the ulna fits into the olecranon fossa of the humerus. All right. So here is so you see that's the radius there. That's the radius right there, and that's the ulna. I told you the ulna have olecranon, and that is the radius. So the radius is the one that is on the lateral. So that's why I call it radiolateral, just to always remember that radius is on the lateral, radiolateral. So you see it on the lateral side of your forearm. The head is like a disc shape. So you can see the head is flat, unlike the other heads that we have been seeing, right? It articulates with the capitulum of the humerus. You see that? Now there is a tuberosity, which is like a projection, a ridge on the humerus. I mean, on the radius. That's a tuberosity there, and it's a bony projection that is medially located. Exactly, it tells with bicep brachii muscles attachment. So that's the radius. Now let's look at the ulna. Predominantly, the ulna, like I told you, the ulna is a medial bone, it's medially located. That is the ulna with the olecranum, which fuse into the olecranum fossa. Now, the trochlear notch on the ulna, which is what you see here, you see the trochlear notch? That's a notch here. This is a notch where the trochlea of the humerus fits into. So you see the trochlear notch articulate with the trochlea of the humerus. Notch, it's also like a depression. You can see here is a point of attachment where its subject can fit into. So trochlea of humerus fit into the olecranon fossa. Fit into the trochlear notch of the ulna, whereas the olecranum of the ulna, fit into the olecranon fossa on the humerus. So the coronoid process on the ulna, which is what you see here, is just the extension of the olecranon, it's extension of the ulnar notch or the radial notch that you see here. You see the radial notch there, that's the extension of it. The coronoid process fit into the coronoid fossa of the humerus. So you see a projection is here, fossa. A projection is here, coronoid process fit into the coronoid fossa. And I'm going to show it to you as we go. Olecranon process, again, is what fits in the olecranon fossa of the humerus when your arm is bent. And that's actually the bone, that's what you feel here, the projection you always feel here. That is the olecranon, and the olecranon fossa right there posteriorly. Stylo process is on the distal process. That's the stylo process there. That's the stylo process. That's the stylo process right there. Okay, that's the stylo process. This is the stylo process of the radius, the stylo process of the ulna. All right. Now, your elbow joint. Let's see again what I've been describing. I want to show it to you now. All right. So the elbow joint is made by you see the radius articulate with the trochlea. That is the radius articulate with the trochlea. Then you see the you see the ulna articulating with the trochlea. With the trochlea of the humerus. So radius articulates, the head of radius articulates with the capitulum. The ulna articulates with the trochlea anteriorly. But when you look at it posteriorly, you see the olecranum fitting into the olecranon fossa. You see the coracoid process, which you can't see on this side because it's on the other side, fitting in the coracoid fossa. So the capitulum of the humerus articulate with the head of radius. That's number one. The trochlea of the humerus articulate with the trochlear notch of the ulna. And then the olecranum fossa, or the olecranum of the ulna posteriorly fits in the olecranum fossa of the on the posterior surface of the humerus. You see that? So these and these are for the ulna anteriorly. This is anterior. And this is posterior. All right. Now, the wrist. On the wrist, the first thing you see on the wrist, you see the carpal bones, which I told you there are 8 of them. So there are 8 carpal bones. When you are looking at it, if you take your hand like this, you see that this is anterior view, and this like an anterior view, like you're looking at this. And so this one here is right arm right there, right arm. That's right arm right there. All right, so that's right arm right there. And this is, we call this the pollex. All right, we call this the pollex. That's the pollex. The thumb is actually called the pollex. I know we call it thumb. All right, that's the radius articulating with the carpal bone, the ulna articulating with the carpal bone, and that from the wrist. There are 8 of them here. And like I told you, this is the right hand. So it's like you're doing like this now. This is the right hand. And now when you look at this, you see, this is the right hand, right? So this means this is the medial part. The medial part of the wrist is where you say the tricutum. And I joke with it that medial part because M ends with M is medial, tricutum. All right. Then right here, you see the pisiform there, you see the lunate, you see the scaphoid, you see the trapezium, you see the trapezoid, you see the capitate, and the hamate. So those are the 8 carpal bones. Then the next set of bones you see are the metacarpal. This doesn't have specified name. We just call them metacarpal 1, metacarpal 2, metacarpal 3, and metacarpal 4. Then you have so the best way to look at this is if you are looking at it posteriorly now, right? This is posterior view. And like I told you, this is right hand. You can say this is the right hand. This is the pollex right here, and it's your right hand. Now, if you look at this, you're going to see the trapeze, so this is right hand, right? So on the right hand, the medial parada is going to be trapezium. So if you stand like this, the trapezium is closer to your body than any other bone. So the trapezium is actually the one you look at as the medial one. So this is what is closer to your body, trapezium. Then you have the scaphoid, you have trapezium, scaphoid, you have the lunate here, you have the tricutum here. Then right here, you have the hamate, you have the capitate, and the trapezoid. All right, so you have trapezium, then trapezoid. All right, so those are the bones there. Then again, these is called the pollex. Now, what is key about the pollex, the phalanges on the pollex that is different from the other phalanges? The phalanges on the pollex only have 2 phalanx. So you see there is one here and there's one here. So we call this distal phalanx and proximal phalanx. Whereas on this one we have 3. So there's distal phalanx, there's medial phalanx, and there's proximal phalanx. Now, looking at the metacarpals, okay, I've talked about the metacarpals, so we can go. Now, the longer extremity, the lower extremities or the lower limb. Let's look at that. I'll start to discuss the pelvic girdle. We call the pelvic girdle the hip bone or the os cosa. You see that the cosa bones. Now, the pelvic girdle helps to connect the lower limb to the axial skeleton. Posteriorly, so there are 2 pelvic bones, right? This is one and this is one. Now, posteriorly, the pelvic bone articulates at the sacrum. Here, the sacrum here. And inferiorly, they articulate at what we call the pubic symphysis. Here's the pubic symphysis. Pubic symphysis is right here. All right, that's the pubic symphysis there. So posteriorly, they articulate at with the sacrum, and anteriorly, they articulate at the pubic symphysis. And here is a fibrous cartilage. We call it fibrocartilage. Now, when you look at this, there are 3 bones that makes up each of the hip bone. So the 3 bones are the ilium, the pubis, and the ischium. So ilium, and if you look at the name, you can think about it as hip as well. Ilium, ischium, and pubis. AIIP. Ilium, ischium, and pubis. So those are the bones that makes the hip bone. The ilium is the largest bone. The anterior one is the pubis, and in quote, this ring or that posterior ring is the ischium. Now, the caudal bone, like I told you, they are made up of 3 bones, and I've looked at that. Now, looking at this to show it in a clearer manner, you will see that here is what we call the acetabulum. And again, you should be able to know the difference between right and left on this. Where the acetabulum is facing is actually the side of the hip bone when you have positioned it anteriorly. All right, so if you position it anteriorly, which is like what you have here, then the side where the acetabulum is facing is the side of the bone. So if this acetabulum is facing to the right side here, I mean, it's facing to the left side here in code, right? Because anteriorly, this is going to be left, right? So this is going to be the left side of the bone, and this facing this side, this is going to be the right side of the acetabulum. So if you're looking at it anteriorly, you look at it that way, that the right, wherever the acetabulum is facing, is the side of the bone. Now, when you want to look at the anterior view, it's going to be when the iliac fossa is facing you, and then the acetabulum will be on the lateral side. So acetabulum is on the lateral side. Think about it when you're standing, your hip, your femur is on the lateral side, right? It's on the side. So acetabulum is facing that side, the femur just plug into it. All right, so that's acetabulum right there. Okay, so here's the acetabulum right there. And here we have what we call the obturator foramen. Here we have what we call the canal, which I'll talk about it. This is actually what forms the birth canal in women. All right, so again, see the coxa bones articulate, like I told you. Lower extremities articulate with acetabulum, a depression of the lateral surface. On the lateral surface, anteriorly, coxa bone articulate with each other, pubic symphysis, and posteriorly at the sacrum. I've talked about that, right? Now, when you look at the male and female pelvis, you will know that they are different because the ischial spine is different, and then the angle, the pelvic arc is different. The reason is different, or they have different sizes, is simply because of the physiology. Anatomy determines function. Structure determines function. What the body is going to be used for determines the structure of that part of the body. So in males, you will notice that the hip bone, the pelvic girdle, is narrower, but in female is wider, which is what happened at puberty, and that is when you notice that the hip in females have wider hips than female and than male does. And the reason for that, it's simply to allow for childbirth. Babies does not need to come through this for men, but babies need to come through this. The baby's head come through this, and so this must be they must be able to do that function, the physiology of that. So the pelvic arc here is less than 90 degrees, whereas the pelvic arc here is more than 90 degrees. You know that this is shallower and lighter, which it is larger and heavier. There's larger acetabulum because our femurs are thicker in males, right, than in female. Then there is smaller acetabulum in females. The sacrum is longer and narrower in males. In females, the sacrum is wider and shorter. And again, these account for higher height in males than what obtains in females. Now, looking at the lower limbs, I'll be fast with this. Looking at the lower limbs, there are 30 bones that makes up the lower limb of each. So that means in total, we have about 60 in total. You have the femur, we have the femur, we have the patella, which is what we call the kneecap. We have the tibia, and we have the fibula. So looking at this is what we call the kneecap, which is actually called patella. But we call it kneecap. So that's right there. That's the patella. There is a sesame bone, and we have the tibia here. You will notice from here, contrary to what you see in the upper limb, when the ulna and the radius both articulate with the humerus, in the lower limb, the bone, the tibia articulates with the femur, but it's only the tibia that articulates with the femur. The fibula does not articulate with the femur. The tibia is medially located, so I call it thick tibia because it's thicker, and that helps us to know the difference. And then I call this fibula. So you say thick tibia, fibula. Then we have the tarsal bones here. Instead of carpal bones now, the bones that of the ankle, we call it tarsal bones. Tarsal bones simply, there are 7 of them each. So there are 14 in total. Then we have metatarsal, just the same way we call it in our upper limb. Carpal bones, metacarpals, and phalanges. So the same way we have tarsal bones, metatarsals, and phalanges. All right. This great toe, we call it hallux. We call it hallux. All right, so looking at the femur is, there are 2 of them, right? 1 per bone. And you have, on the femur, there's a head, which is what articulates with the acetabulum of the hip bone, and it makes the joints that we call acetabulofemoral joint, meaning that acetabulum and femur, acetabulofemoral joint. All right. Now, on the head, you have a depression here, which we call fovea capitis. Now, there's greater trochanter here. So you have the greater and lesser trochanter, which are point of muscle attachment as well. Now, on the femur, you have the neck, and you see the neck there. You have the neck is common fracture site. Now, you have the shaft. Here's a shaft. All right. Every long bone have the shaft, the epiphysis. You remember from the previous chapter, the epiphysis, then the shaft. Then we have the linear aspera is a ridge on the shaft. So there's a ridge on the shaft that we call the linear aspera. So that's a ridge there that we call the linear aspera. Now, on the femur, the distal end of the femur, which is the part that articulates with the tibia, we have the lateral condyle is here, the medial condyle is here. Again, we have another condyle, which is the epicondyles, and I'll be showing that to you. So if you're looking at the posterior here, you see these are the condyles. These are the condyles, and then the epicondyle will be at the above the condyles like that. So we have the lateral condyle right here. Then you have the epicondyle right above the epi. Like I told you, it's above or outer. All right. So that's here. This is anterior view, and in between the 2 condyles, you have what we call the intercondylar fossa, meaning there is a depression between the 2 condyles. When there are 2 elevations, there will be 1 depression in between, right? So that's the idea. So this here is the patellar surface. That is where the patella is going to sit in. And yeah, I think that's that. Now the patella, this is the patella, and that is what we call the nail cap. It's a sesame bone, and its major job is to protect the nail from impact. Now we have the tibia. Like I told you, the tibia alone articulate with the femur. The fibula does not articulate. Now, so that means that as the weight is coming from the femur, it comes straight to the tibia. Weight is not transferred to the fibula. The fibula does not bear weight. It only reinforces the fibula, the tibia. So the lateral and medial condyles are on the on the tibia. You see that there? That's a lateral condyle and that's a medial condyle. These articulate also with the condyles on the femur to form what we call tibio-femoral joint. Now, on the tibia, we have what we call the tibia tuberosity, which is what you see here. This is the tibia tuberosity there. And it's an attachment for patellar ligament because patella is right above it, right there, right in that region. All right. Then the distal end, we have the malleolus, which is the projection you always see on the medial side of your ankle. That's the medial malleolus. Now, on the contrast, the lateral fibula have lateral malleolus, which is going to be the projection you are going to see on the lateral side, okay, of your ankle. So tibia have medial malleolus, fibula have lateral malleolus. Now, the fibula, the proximal end of the fibula, proximal end is usually the end that is closer to the point of attachment, and distal end is the point that is away. So this is the proximal end of the fibula or the proximal end of the tibia, and this will be the lateral end of both of them. All right. Now, when you look at the proximally, the head of the fibula articulates with the tibia, not with femur, right? It articulates with the fibula, with the tibia to form what we call tibio-fibular joint superiorly. Now, on the inferior end, they also articulate with each other, and we call that inferior tibio-fibular joint. So here is the inferior tibio-fibular joint. You see that? Inferior tibio-fibular joint. And the superior tibio-fibular joint is right there. All right? So proximally, it makes tibio-fibular joint superior with the tibia and inferior tibio-fibular joint distally. All right? So the head articulates with the femur, with the tibia, not femur, right? Then it articulates with distal end of the tibia, lateral malleolus, distal end, lateral ankle. I've talked about that. All right, so looking at the foot, I told you there are 7 carpal bones here, and the carpal bones here are easier to name than what you see in carpal bones. So tarsal bones are usually easier to name. The reason is this: out of the 7, 3 of them have the same name. Now, look at this. As you are sitting, look at this way. I'll go back to this image. But as you are seated here, as you are sitting, this tells you how the weight is transferred. So the weight is coming from femur, get on tibia, and then it comes to talus, then calcaneus. So this is what we call the heel bone, the callus. The callus is what we call the heel bone. That is the bone that bears the overall weight of our body. That's the bone that makes us to move when you are walking. It's like the spring that pushes you up, the calcaneus. So weight comes from the femur. So it's like the weight is coming from your head, goes to your vertebral bone, goes to the lumbar bone, the vertebral bones, comes to the femur, comes to the tibia, and comes to the talus, then transfer to the calcaneus. So that's talus and calcaneus right there. Talus, then calcaneus. All right. Then you have the navicular here. You have the medial cuneiform here. You have the intermediate cuneiform right inside there. Then you have the lateral cuneiform there. So the side that have your your great toe is the side where you have the medial side, right? That's the medial cuneiform. Then the other side is going to be the lateral cuneiform. All right, so that's what you have here. You see, the medial cuneiform is here. Here is your great toe. We call it a hallux, like I told you earlier. And here you have your great toe, you have your medial cuneiform, you have the intermediate and the lateral cuneiform. Here you have the cuboid, you have, again, this is talus here, and this is calcaneus. So it's simple to learn for the foot. Now, the same way you have metatarsal, metatarsal 2, metatarsal 3, metatarsal 4, metatarsal 5. That's all you need to know. The phalanges are the same. There's proximal, middle, and distal, but for the hallux, it's just proximal and distal. Now, these are the hikis of the arc of the bone, of the foot. We have the longitudinal arc and the transverse arc. So you see right here, here is the longitudinal arc, and it's made up of the metatarsal bone and the tarsal bones. Then here will be the transverse arc. Okay, so I've discussed everything there. The last thing is when there's disorders. If there's any problem with the longitudinal arc, if it reduces, we say there's flat foot. All right. Then the club foot is when the longitudinal arc increase. All right. Then bunion is when there's deformity of the big toe. All right. So flat is longitudinal arc. The longitudinal arc decreased. All right. That is, if it decrease, then you know it will, the foot will become like almost flat. We call that flat foot. If it's increased, that's a club foot. All right. I'll see you in the next chapter. Thank you.